Chapter 10, Consumer Informatics. A consumer is a patient, clinic, resident, or other recipient of healthcare services. Therefore, consumer informatics is also known as consumer health informatics and is the field devoted to informatics from multiple consumer or patient views. More and more, consumers are using technology to keep in touch with their healthcare providers and to access healthcare information. Health literacy is the degree to which individuals have the capacity to obtain, process, and understand basic health information and services needed to make appropriate health decisions. According to Medicine, 90 million adult Americans have limited health literacy. The Department of Health and Human Services is working to support this problem. The National Action Plan to Improve Health Literacy has established 7 goals: provide access to health and safety information, create change in the healthcare system that would improve health information and communication, incorporate health information into schools and universities, support local adult education efforts, conduct research on health literacy, and use evidence-based practices. Health literacy is not necessarily about a patient's reading ability or education level, but about understanding the terms and concepts related to their health. Health literacy includes the ability to understand prescription medications, discharge instructions, consent forms, appointment scheduling, requests for information, and the ability to navigate our complex healthcare system. It also includes the ability to make decisions related to your healthcare, including understanding insurance coverage and billing and your rights as a patient. A number of factors contribute to an individual's health literacy: communication skills of the patient and the healthcare professional, level of educational knowledge of healthcare, culture and culture-based experiences with healthcare, demands on the healthcare facility, age greater than 65, non-white ethnicity, recent immigrant, poverty level or below, and English as a second language. However, communication goes far beyond the words or language used by the patient and the physician, extending to the ability of the patient to understand implications beyond the fundamental meaning. Health literacy is important for a number of reasons, including the patient's ability to find their way through the healthcare delivery system, knowing what information to share with the healthcare provider, the ability to care for themselves, ability to understand risk. At one time, medical reference books and journals were the only sources of information, other than the physician, on diseases and medicine. Today, the patient has access to an overwhelming amount of information. Patients today get their medical knowledge from many different sources, including magazines and other news sources, commercials and other marketing campaigns, family and friends, websites, and commercials. There are varying degrees of quality from this information. Some provide erroneous, outdated information. Some provide quality information. Consumers do not always know how to determine the difference. Medical terminology is sometimes called the language of medicine. The healthcare provider may believe that he is explaining the patient's condition in simple terms when in fact jargon is being used. Jargon is specialized terminology used by a specific group, in this case, the healthcare professional. For example, in health information management, terms such as MSDRGs, health information exchange, and notice of privacy practices are familiar to providers and HIM professionals, but patients do not necessarily understand them, even if they have heard them at all. Problems with understanding healthcare jargon makes it difficult for patients to make informed decisions about their healthcare, or for them to understand the decisions that they make. This can lead to negative outcomes. There are a number of ways we can help improve compliance and understanding instructions. You could bring a family member or friend to appointments, use terms that are easy to understand, avoid jargon, not overwhelming patients with information, and providing a comfortable environment in which to discuss their health. There are health literacy tools such as pictures and strategies such as Teachback and Ask Me 3 available to healthcare providers in order to help patients improve patients' understanding of their health. The Teachback communication strategy involves using simple language to explain the patient's condition and then asking the patient to repeat the information in their own words. The Ask Me 3 initiative consists of 3 questions. What is my problem? What should I do? Why do I need to do this? Consumer health applications are healthcare-based applications designed for use by the patient or provider on smartphones, tablets, and other computers. Patients use health applications to access health information, promote a healthy lifestyle, track calories and steps and more, manage their conditions, and access their PHR. The healthcare provider uses it to access patient information, communicate with patients and other professionals, monitor patients, and provide telemedicine. Telehealth is defined as the use of electronic information and telecommunication technologies to support and promote long-distance clinical health care, patient and professional health-related education, public health, and health administration. Telehealth technologies include video conferencing, the internet, store and forward imaging, streaming media, and wireless communications. Telehealth is a subset of telehealth that focuses on the provision of care, whereas telehealth includes administrative uses and education. Telehealth technology can be used for electronic visits, also called e-visits, which can take the form of real-time videos. When using live video for an e-visit, the patient and provider communicate synchronously, meaning both online at the same time. The store and forward method includes videos that have been pre-recorded, pictures, email, and more. E-visits provide a number of benefits, including improved access, flexibility in care, greater quality of care, improved efficiency, and decreased costs. In addition, patients who live in rural areas can reduce or eliminate trips. Patients are able to be monitored while going about their day-to-day business. Hospitalizations may be reduced as health issues may be identified early. Patients can also submit results concerning blood sugar and blood pressure to their healthcare professional. In addition to being more convenient for patients, telehealth has led to better outcomes, reduced cost of care, and higher patient satisfaction. As a result, the number of patients using telehealth is rapidly increasing. This is expected to increase to 3.2 million patients by 2018. Several factors are contributing to this increase. Patients are more engaged in their health care. The Affordable Care Act provided incentives to healthcare facilities to implement various telehealth models. Employers are now offering telehealth to employees as part of their benefit program, and insurers are now paying for telehealth services. However, there are some disadvantages: lack of funds to start telehealth programs, no face-to-face interaction, issues with patients' technology, and reimbursement for e-visits. Patients are also using telehealth to take daily ownership of their healthcare by using wearable devices, such as fitness trackers. One prediction is that there will be 213 billion wearable devices, including watches, wristbands, clothing, and eyewear, sold by 2020. One of the benefits of consumer informatics is that these technologies encourage consumer engagement. Consumer engagement is a diverse set of activities that can include interacting with healthcare providers, seeking health information, maintaining a PHR, and playing an active role in making decisions in regard to personal health care. Research shows that for consumer informatics to have a positive impact on patients' health, three factors are key: individual tailoring of the interaction based on the characteristics of the patient, personalization, which is customizing the program specifically for the patient, and behavior feedback. In order to encourage patient engagement, the Blue Button campaign was established by the ONC. It is a consumer-motivated method to improve healthcare by having the patient or caretaker actively involved in decisions and planning by having direct access to personal health information. The blue button logo signifies that consumers can electronically access their health information in a secure and easy manner. The benefits of consumer engagement include reduced costs, increased communication between physicians and patients through the use of technology, improved patient satisfaction, and population health. Population health is recording, reporting of healthcare data that are used for public health purposes. If each individual patient's health is improved, then the health of the population is improved as well. Population health allows the healthcare provider to report infectious diseases, immunizations, cancer, and other reportable conditions. Three key consumer informatics applications are patient portals, PHR, and social media. A patient portal is an information system established and maintained by the healthcare facility that allows patients to log in to obtain their health information, register for appointments, use secure email, download forms, update demographics, and fill prescriptions. The benefits of portals include strengthening communication between the healthcare provider and the patient, providing patients with healthcare information, providing resources to the patient between patient visits, promoting patient engagement, and improved efficiency. There are two types of patient portals: standalone and system integrated. Standalone portals do not have all of the features of a system integrated portal and are typically used by smaller healthcare providers. System integrated portals are typically a function of the EHR and are a fully functioning system. The portal itself is owned by the healthcare provider or some other agent, such as a vendor or insurance company. The information is owned by the patient. Personal health record. The personal health record is an electronic or paper health record maintained and updated by an individual for himself or herself. It is a tool that individuals can use to collect, track, and share past and current information about their health or the health of someone in their care. The PHR contains information that comes from both the physician and the patient, but the PHR is controlled by the patient. The PHR is important because it links health information from all of the patient's care providers into one central location. This helps improve the overall quality of care. The patient's health information from a provider can be downloaded to the PHR. A shared data record is maintained by the patient and provider, health plan, or employer. Several items should be included in the PHR. Personal identification, including name and birth date, people to contact in case of an emergency, names, addresses, and phone numbers of your physician, dentist, and so forth, your insurance information, living wills, advance directives, or medical power of attorney, organ donor information, a list and dates of significant illnesses and surgical procedures, and dosages, immunizations and their dates, allergies, family history, and key test results. Much of the information in the PHR is the same as in the patient portal. The distinction between the two is that PHR is created and controlled by the patient, whereas the patient portal is created and controlled by the healthcare facility. There are currently 4 common formats of PHRs: paper, personal computer, internet, and portable devices. Internet PHRs may be tethered or untethered. Tethered PHRs are connected to the EHR and allow patients to access information contained within the EHR. Untethered PHRs are not connected to the EHR. One of the benefits to tethered PHRs is that patients can identify any errors and therefore request a correction. The patient controls who has access to this information and what information it contains. Social media are online tools that allow people to communicate. Healthcare facilities use social media to advertise services, promote wellness, provide health education, provide support forums, and provide other communications to their patients and the general public. The benefits of using social media in health: building a sense of community for patients with chronic diseases. Patients are better informed and can track their health. Patients can search for clinical trials that they might qualify for, and it builds awareness of their condition. Patient information cannot be exchanged via social media due to privacy laws, but healthcare facilities may use social media to share emergency room wait times, list new services, gain information about patient satisfaction. Healthcare facilities must be careful when using social media because patient privacy can be compromised. The healthcare facilities' policies and procedures should address who can access social media from within the healthcare facility, improper usage of social media, penalties for improper use of social media, the responsibility of employees to report improper use, ensuring that employees know that statements on their personal social media accounts can impact the healthcare facility. E-patients are engaged patients.